Hi everyone, this is Aditya Sharma. I run a very unique fintech company focused on health called Affordplan.
You said that Affordplan is a fintech focused on health. Just help me understand exactly what do you mean by that? What is
We
Affordplan?
work with hospitals, which are our primary target group, to drive up their revenue through higher utilization of all their services inside the hospital. That's what we do right now. We are now getting into the cost side as well. So that's what we do. That's our job.
You drive up revenues of hospitals.
Yeah. How per patient realization. So we have a product, current product, which is called Swasth. That so today, what is the insight? Mostly people are indifferent to which hospital they would like to patronize. What we try and do is we eliminate that doubt. Point number one, we try and get you to work with one hospital who is our client, right? uh, Second, what we try and do is you utilize all the services in a hospital. Now, hospitals are very adequately equipped to take care of all your healthcare needs, but for whatever reason, you know they are not able to see patient completion journey, whether it is IPD, whether it is pharmacy, whether it is lab. Some of the hospitals that we work with, very good labs, but not high utilization, right? So on one hand we work with them, but the main objective is to focus on the real problem, which is 10 crore Indians falling below the poverty line. Through the hospitals we reach out and to the customers and reduce their kharcha. That's what we do.
Uh, can you zoom in more? Give me a couple of examples of how you reduce the patient expense. Are we talking of an insurance product?
No, insurance in healthcare has its own issues. We have micro insurance products, which are smaller tenure, smaller coverage. So India mein insurance penetration is on the lower side. It will continue to be. Yeah. Privatization happened almost 40 years back. Before that, health insurance has always been around, but the concept of insurance doesn't settle with many Indians, right? Where it's not considered as an aspirational product. So, if you look at India, very high savings as far as gold is concerned, because it can always come in use. Massive phobia with most Indians: let's buy a house, right? Son's education, daughter's marriage. If you go back to the 80s, now fortunately for all the right reasons, they are educating both. Healthcare, if you tell them what happens if you got a bad situation in health, we are anyways a very fatalistic society. Okay, destiny, that's written
Mhm.
in our brains, what can we do? Also because the premiums are increasing very very fast. 25-30% jump in premiums. I won't quote numbers, but I'll just say there's a fairly steep jump. So what we do is we load up micro insurance products, which are can be different, can be a small vector bond product, can be a personal accident product. They are available in the market. We work with insurance companies to kind of make edits and launch it. We are not an insurance company, but our job is to bundle it all together so that the overall journey of a patient becomes less expensive. So what happens in a hospital today, they'll end up giving discounts. Discount is, water down the drain, doesn't mean anything. What we are saying is, don't give a discount. Get the family hooked on, family, friends, relatives hooked on your hospital. So every time he comes, he's getting a benefit, provided he comes back later. Ideally, we would like to make the costs as low as possible for health for patients. But that's like a that's like a dream. What we are encouraging is frequent testing, healthy living, right? Which means that if you are managing these two well, your longevity is better, quality of life is better, and your sudden healthcare expenses will not go outside the window. So we play that bridge between responsibility, between ensuring our hospitals are well lubricated and the patients are running well.
Uh, okay, can you? Is this like a loyalty program membership?
It's a loyalty program with lots of bells and whistles. So whenever people say it's a
Talk
loyalty
to me about
program, I
one
cringe.
specific program, like one specific program that this is what it costs, this is what you get as benefit. Like, just give me details.
Cost is like we keep it to a minimum. It can be free also. We don't want to have a situation where people say, okay, I'll think about it. So it can be as low as $100
What's the customer journey? How would a customer discover this
inside the
program?
hospital. So our CAC is
Okay,
zero,
okay,
marketing costs are zero.
okay.
When you come inside the hospital, because healthcare is also very need based.
Mm.
When I am healthy, I am not going to a hospital. It's not a mall. So it's a very need based product. Once the minute we got to scale, how do we ensure cost is reduced to the bare minimum, right? Which we've managed to do, uh, which can be $100 free. They advise you, they tell you what the product is. There is an app.
How would I discover that your counselors are there? Is it at the time of bill payment, or if I'm going to the inpatient
Floor
department?
mapping in multiple areas: pharmacy, lab, reception,
Okay.
in multiple areas. Larger the hospital, larger the floor, larger the number of people.
And what
Right.
would the standee say? I'm assuming there would be some standee or poster.
Standee will say in English, reduce your healthcare costs. In
Okay.
Hindi, it will say bachat. आपके cost में बचत,
ठीक
right?
है. Got it.
So that
Okay.
is what it will say. She educates you. You download an app, right,
Okay.
and you get onboarded. Immediately, you will see a micro insurance is available to you, which covers some part of your cost based on certain conditions of cost. Should you want a loan, you can always say, "I want a loan." We will have that settled with some of our MBFC guys. Uh, so that's what it is.
Okay. Okay. But each hospital has a unique app. Like, it's
Yeah.
not like Affordplan app in general where you
No,
choose
no,
which.
no. सब जगह हॉस्पिटल का नाम है.
Okay. Okay. Got it. Got it. Can I take insurance for my current use case, or insurance is like in case in future something happens? Obviously, right? It will not
You
cover.
get insurance for a limited period, irrespective.
Okay.
But depends. We have both products: Hospi Cash and personal accident. Right.
And what are these products? What do these mean?
Hospi Cash is key. If you fall sick, you can get coverage based on the number of days that you are in the ICU. There's a certain limit. Personal accident is if you had an accident. You accident can be anything. It does not have to be a car accident. It can drop. You dropped an iron on your foot. You fell down. You broke your leg. You had burns. All of this is covered, and so they will give you coverage of a certain value, 60, 70,000. We are saying, hey, we are not going to give you for paying nothing. We are not going to give you coverage of 10 lakh, 15 lakh, but we'll give you some amount.
Okay.
So even if we can't change the world in one
And
go,
this
we'll
is
change it.
free when you join for a limited period. Like, let's say 3 month insurance, you get free, something like that.
1 year generally. You can
One
renew
year insurance, you get free. Okay. And then you renew if you like it. Okay.
if you
Okay.
want to.
So, how would the patient show the hospital that he is transacting because he has the app? Like, to earn cashback, he needs to scan the app or something. Like,
Yeah, yeah, we have QR codes. So it's very simple.
how does it happen? Like, if I go to the pharmacy, what will be my experience?
You will go to the pharmacy, you download the app, you scan the QR code, and you can use your debit, credit, cash, whatever you want to make the payment. So for a patient, nothing has changed. Life as usual.
Okay. So instead of paying through Google Pay, I pay
You can
through.
no no you can use Google Pay, but it happens on our app.
Okay.
You can
So,
use UPI, you can use cash, you can use anything, but it's happening through our app.
and what am I scanning? There is a dynamic QR code, or there's a QR code pasted on the window?
There's a QR code pasted over there, and
And
it has the offers. It will tell you kya offers hai, and
hmm,
your journey starts. And you start spending.
is there a like how does the hospital see you? Do they see you as a loyalty solution provider, or what do they see you as?
See,
Do they see you as a software provider who's powering their loyalty app?
no, hospitals. So let me tell you how hospitals think about this. Most hospitals, rather, hospitals are mainly focused on clinical excellence, and that's a massive area of responsibility. Look at the amount of changes that are happening on the equipment side. uh, India is not an easy place to run a hospital. You have some of the highest real estate costs. On top of that, across the world, there are new products that are coming out every year, which means there are very frequent upgrades, massive training it's only when you get inside a hospital you appreciate the amount of complexity that they deal with. So this is something that they look at us as partners, and that's how we present ourselves. So our program is designed in a way that there is complete there is complete faith and trust between us and the hospital. For example, they know that their cashback cannot be utilized anywhere else. He cannot go to a petrol pump. It is completely secure. They are aware of the fact that their patient data is not going to be leaked. See, when a guy comes to the hospital, he's as it is unhappy. Either he's in pain, right, or he's emotionally disturbed. On top of that, he doesn't want to come and figure out that there is more information, more pain, more restriction. So we keep the product in a way. Entry is very easy. There is no exit fee or anything. It's as and when you feel like. And in addition to that, we'll deliver medicines, we'll deliver your tests, etc., etc.
Okay. So this core product is what you said is Swasth.
That is correct. When I look at healthcare, or when I'm wanting you to look at healthcare, please remember only 1 in 20 needs hospitalization. The remaining 19 don't need hospitalization. And in the numbers that I give you of people who are impacted because of rising healthcare costs, it's not the surgical costs that are killing them. It is the out of pocket expenses. If you look at India, we have the highest number of patients in diabetes, cancer, cardiac. Your disease prevalence is starting earlier. You're getting a lot of situations where young people, obesity is a problem. On top of that, stress levels in the country are slightly higher than average, right? I think if you're just traveling from point A to point B, it can be difficult. Imagine some of the other things that are going on. So this is the reality of our lives, and we will face this more and more.
Hmm.
Vitamin D, vitamin B12, I don't know what is going wrong, but our bodies are not retaining at all, and it is vital. I'm not a doctor, but any doctor will tell you.
So, I've been a Fortis customer for a while now. Fortis has a Fortis app, and often they will tell you that you can book an appointment through the app. You don't have to come stand in line, etc. Or you can get your results through the app. You don't have to wait at a reception for getting the results. So essentially, it's like a hospital ERP with the front end for customers where they can do all of that. Now, for a customer, it just sounds like friction if I have one app which is like integrated with the hospital ERP and a second app which is for loyalty.
It can be one app. We work in a way that it is basically part of the hospital app.
Okay, okay.
You
So
don't
this
have to
can
do.
be embedded within
Yeah, yeah,
the existing hospital app, and whatever payment related functions are there, those are powered by Affordplan. The rest of the functions, whatever ERP the hospital is using, it's powered by that.
yeah.
Okay.
So it's because
Uh,
one or two hospitals now might get a little irritated.
uh,
So we have to be a little careful.
ठीक है, got it, okay.
Healthcare requires a different handling. It requires a lot of empathy, right? And the minute you reverse it and you start over commercializing everything, that's when the revenue model will also collapse.
Hmm.
Uh, so, yeah.
So the uh, the loyalty part of your offering seems to be something which could be attacked by, let's say, a company which is focused on loyalty, like say this Capillary. Capillary is a loyalty focused business. They mostly do retail, I think, a lot, or at least they have a lot of retail clients. So they power the loyalty for retailers. But for them to enter healthcare, they already have the technology and the know-how to build the product. How do you? What is your defense here? What's your moat?
So let me give you a small idea about what comprises of our org, right? We have people who come from the traditional product and technology. We have people who are coming in from financial services, consumer behavior, healthcare, wellness. You have to bring a lot together. It is not necessarily a tech play, right? You have to talk a different language. Sure, I mean, it seems very simple, but in reality, to be able to pull it off product after product. It's not as simple. Ask me. The hair that you see on my head was into two uh, 4 years back, right?
Hmm.
Uh, and you know, unlike in a retail where many things can go wrong and you'll still have patience. Imagine you're sitting with a broken leg and something goes wrong. Nobody is going to entrust you with their finances and health and have a bloomer. It is the end of your life. So you have to be very careful. In addition to that, we spend a lot of time with our people who are on the floor, right? Which means there is a fairly strong physical element as well. So there are quite a few areas which make it, I won't say impossible. Nothing is impossible. Should a person have the will to want to fix it, why not? In our case, it is also a very purpose driven business, and that perhaps is our biggest moat. I and my two co-founders, Dr. Prithvi and my school friend Anand, we firmly believe that we want to change this. And for us, any adversity is not the be all and end all. We'll find a way to fix it. For me, this came about when I worked in an impact fund and I had to travel from, in a life which was focused on large cities, etc., etc., to other parts of India. I saw India for the first time. That's when you realize what's going on. You're lucky to be born on the right side of the tracks. So for us, I think the fact that we are purpose led is our biggest moat. Everything else, it's the intangibles always, Akshay, that matter more. Anybody can copy anything, but how, what keeps you up at night? It is the fact that, yeah, I want to figure out what to do with cancer, for example. So we've been thinking of cancer now for the last 8 months, 9 months, and we still haven't figured out our journey. We will eventually. It's not that easy. We can go and get great oncologists on board and they'll come up with something. How do you create something out of it? And we want to also ensure that we are not doing anything on the clinical side. That is not our area. Yes, we will have great doctors. One of our partners is the pioneer of transplant surgery in the country, and he ran a very successful chain of hospitals. It's very easy for us to, and very tempting, but we will stay clear of that. So I think that is our moat.
Okay, got it. Your core value proposition or the mission that drives you is affordability. And each of these programs, like a maternity program, for example, makes maternity related services affordable. How does it make it affordable? How do you get a hospital to give a special pricing?
So you make it affordable through a combination of microinsurance, loans, cashbacks, wellness programs which are available at a very very steep discount. So everything you are reducing price. So it's not just one area. And I will not want to overemphasize on surgery, because I will say one thing, that again, you're not dealing with that small group that needs surgery. You're also dealing with chronic patients, right? So for example, geriatric, I gave you that example. Maybe I was not illustrative enough. You suddenly are confronted with some weird disease which is chronic. If only you are a little careful, there is also some behavioral change, right? The journey of reduction in healthcare costs is not the responsibility of the hospital on its own. It's also the responsibility at the patient level. So that's what we will try and build and incorporate through, whether it is through our app or through our nudges and notifications. So it's a 360-degree view. It works when all parties play together.
Okay, so what you're saying is one part of the value add is a reduced price, but that's not the only value add. If you can prevent the expense from happening in the very first place, then that itself is cost
Yeah.
saving.
Yes.
Uh, okay, okay, understood. And I'm assuming the way you prevent that expense from happening is like a what they call as digital therapeutics, like essentially uh, tracking patient activity levels, step count, etc., like integrating with their fitness watch or whatever they wear, giving
amongst
them.
other things.
Okay, one part is prevention, and how so the third piece is actually reducing the cost of the procedure. So that is like something which you negotiate with the hospital, that we will get you bulk customers, so give us a bulk price. Is it something like that?
Yes, I would say in the ballpark,
Okay,
in
okay,
the ballpark. But we will.
like a volume discount.
I won't get into that. No, we don't acquire patients from outside directly. We are building a very strong program on how to acquire patients from outside. But everything is currently used through a combination of the factors that I mentioned, which
Right,
is
driving existing patients back to
yes,
the
yes,
hospital.
which is using their cashback. See, hospitals can be plagued by a lot of discounts, right? And uh,
I haven't heard of discounts from hospitals.
oh, you are you are amongst the you are an ideal patient for a hospital.
Why is that? How does the discounting happen? Just give me an example. Like,
सब जगह होती है. You don't give good discounts on your pharmacy. You step outside, there's massive discounting going on,
pharmacy, of course, I know outside
right?
hospital is discounted.
Labs, same.
Uh,
Surgery में for cash patients, they will always start bothering you for a discount, right?
okay, okay,
People will float around.
okay.
So discounting is a big part of the any hospital's bane. And
So,
one,
if, for example, I'm going in for like a maternity surgery, before I select the hospital, I'll ask them what's the price, and I'll say, is
yeah,
there
yeah,
any discount on it? And
happens
okay,
all the time.
okay,
And
okay,
imagine for a hospital, they've kept on upgrading patient care, kept on upgrading doctors, kept on upgrading equipment. And then people are coming and saying, I can go X, Y, or Z, who may or may not even have one-tenth the equipment. So, you and I are not necessarily what comprises 80% of the country,
hmm,
right? For you, it's like, theek hai, I'll pay with my credit card. For many of these people, they are having to sell their household jewelry
right.
to fund healthcare,
Hmm.
right? Because that's the reality of our country.
And this you can enable them to pay in installments, like you can offer a
That option is
lending.
also there amongst other
Uh,
things.
okay,
So
okay, okay.
yes. So think about it that we take a problem and we break it into thousands of small pieces, and we then try and see what are the core things that need fixing, and we try and fix that. We don't
Okay.
try and fix everything. What matters
Hmm.
to you, we will try and fix.
Mm, got it. Okay. Okay. So let's talk about the journey of reaching here, where you are today. Is this the version one of Afford Plan? Was it the same, or was there an evolution in how the company and the mission evolved? And just take me through the history.
Version 1 was a very different product, which was
And
completely.
you were not involved in version one, right? So,
I
so
was
how?
not.
Just give me a little bit of a history of like your background and Afford Plan's background, and where the two of you met.
I was working in impact fund. I used to look at many of their healthcare activities and part of their portfolio. And the fourth plan was something that came to us, part of the investment team, a group of investors. And they were not just a fourth plan; there were other people. Not just my fund; there were other funds as well. And over a period of time, I landed up becoming from a investor to a consultant to a COO to a CEO, and then finally I bought it out. So the erstwhile product I had nothing to do.
uh, you were at low capital when you got the pitch for a Ford plan. I think there was a 10 million round in which low capital participated in 2018. What was the pitch at that time from the original founders?
I think it was very similar. There was nothing radically different, and
Like a
that's why,
loyalty, powering the loyalty program of hospitals.
yeah, similar,
Okay.
may not be
Okay.
identical, but the
Hmm.
thought process was on how do we handle the healthcare costs, right, for patients. So the pitch was similar, the means and mechanisms were different, the execution was different. And I would put it down to the natural evolution of business learning. When you start off, you have an idea, you don't really know what you're doing. I think if I were to look back, as maybe I would say, as what is the mistake that one can learn, is your pilots have to be very tight. Your revenue model needs to be very, very visible, and expansion should not start uh, at a
Premature.
earnest level unless you are very clear. Uh, One very key point over here is nobody can afford to fall in love with his or her own product. That is a classical screw up that I have seen in multiple areas where you get emotionally attached. It's not easy to distance yourself, but you have to be highly dispassionate. That no matter what happens, if it's not working, when do you pull a plug is actually very important for all founders. And mostly, if you see, most people land up continuing when they should have pulled the plug. You have to be
Okay,
merciless.
you are saying कि business model same था, idea same था,
आई
and
टेल
then
यू क्या हुआ, बिजनेस मॉडल में उन्होंने प्रायोरिटाइज किया पेशेंट पहले, अफोर्ड प्लान पहले, हॉस्पिटल लास्ट. Doesn't mean that your history or your story or your future is over. It means that you need to go back.
Hmm,
Either the product is the problem or you targeting it at the wrong hospitals. Not,
hmm,
you don't need to be in every hospital in the country.
hmm,
You can
hmm,
still make a huge impact and build a scalable business, which is, at the end of the day, it has to be profitable. Nobody does anything for free, but you need to realign your lens, and you may need to make innovations all the time. It's very simple. Amazon, what does Amazon say? It's a good example. 9 out of 10 are going to fail, right? So failure cannot be a setback, and that's where the purpose led org comes into play. You have to keep at it, you have to keep moving things along. So I would say it was a natural evolution. Mistakes were made. The only thing that perhaps could have been done better was to pull out the plug, which is now something that we embrace. We pull out the plug first.
so the erstwhile model could be something like what say Kenko
No,
has,
no, very different. It was largely focused on small hospitals which were doing maternity.
but this was B2C. You said the hospital came at the end of the model,
The
so they
product
would.
was designed in a way that perhaps the hospital didn't see the benefit very quickly, right?
Uh, was it like let me give you a hypothetical product and you tell me if I'm right or wrong in my understanding. uh, there would have been a way to enroll people onto a maternity plan, and there would have been x number of hospitals, say 10 hospitals, where you can choose, and it would have been a special package, and the pitch would have been that if you are pregnant, then come and join this
No, no, no,
program.
no, no.
No, not that.
Our program
Okay.
didn't work like that. See,
Okay.
B2C, what direct B2C. These businesses, this business is B2B2C, and even the erstwhile business was B2B2C.
You said that deferred delivery is something you're changed in the product. What does that mean?
So basically, it means that we will work with hospitals to ensure that a patient can see uh, visibility on delivery costs being reduced over a period of time, because we kind of help him build a kind of a savings bank with the hospital. The more you spend, you
Okay.
can see कि आपकी आगे जाके जो डिलीवरी है उसके कॉस्ट कम हो सकता है.
Got it. Got it.
So there
Okay.
is this story of this guy called Dr. Edward Jenner, and this is how the smallpox vaccine was discovered. What he realized is that all the milkmaids who were dealing with the cowpox disease never got smallpox. So it's not that many of these things are because of intense research and development. Sometimes the answers are sitting right in front of you and you jump over it, or you don't even think about it. You have to keep your eyes and ears open. But till you do it, till you don't do it, you'll never know.
Okay. So I want to kind of understand you as a founder, and you are an investor turned founder, which is a very very unusual case. In most cases, it is founders who get an exit and become investors. I've rarely seen an investor who quits being an investor and becomes a founder. How has that shaped you? What is the way in which you think about running an organization? What are the uh, behavioral differences between you and another founder who would not have been an investor first? How did being an investor shape you as a founder?
So I think you're always very cognizant about what is the end result, because as an investor you're always looking at your multiple on capital, your ROI. So you are always far more financially savvy. Why am I doing this? So the first thing that changes is your ability to create a product is always dependent on the end result. So unless something is scalable and profitable, you will not go on plugging it away. We always keep going back to that discussion of being able to pull a plug. It's far easier for me to pull a plug, right, than it might be for some of my other colleagues or my other people who are generally who start the journey as founders. uh, the risk is, you can you pull the plug a little faster? Sometimes that can happen. So then you have to surround yourself with people who kind of balance it out, and whether as in senior colleagues and whether as other co-founders, which is why we have three co-founders. We also have a set of advisors who come from healthcare, come from consumer product, been my ex-boss, so that you're careful. uh, so that is one. Second is, investment is all about process. As you can make a small error in your process in investment, and it can have massive consequences. So you force people to become more aligned in terms of process. Have we done this? If we haven't done this, we will not get to the next step. If you ask me, my biggest struggle was this: getting people in business to start thinking process, because they are so execution oriented. They'll start something tomorrow without thinking about the consequences. uh, so there are pros and cons. Your ability to take a risk is actually higher as an investor, because you will always take punts on certain areas where other people may or may not be clear. So you realize that if you're not taking a risk, it's not going to work out. So you will take a risk even if you see 70-80% के ऊपर clarity नहीं आ रही है. As long as you have some idea of the end road in mind, you will move on. Um, some of these areas have been very beneficial. I have been blindsided maybe in certain other areas, but as I said, you create an org which hears, which listens, and you trust people to take that judgment. And you say, hey, where if I can't play a T20, I will at least have people on my side who can play the T20. Because as an investor, you know that your investment does not necessarily make sense only if you decide that you are Pele, Maradona, and Messi all rolled into one. You have to find the right talent, because you can't do it all alone. So that becomes something which is easier. Delegation is faster, quicker. You don't take, I'm going to land up doing everything on my own. It's not possible. So those are certain advantages. I'm actually surprised why not so many investors have moved into founder roles. In fact, I do know quite a few actually who have said, "Ki I've had enough of this spreadsheet and legal vetting going on, and I want to get my hands rolled up." Chris Capital, Ashish Dhawan, great example. Ashoka University. So there are quite a few, and I'm 100% convinced that they will be as successful as first time founder.
Mm. Okay, fascinating. Um, you did a turnaround of Affordplan. I would love to hear that turnaround journey. When you joined, what kind of revenues were there? What was the team like? How did you change things?
So I can't recall the exact revenues, but let's just say that the cash burn was maybe five times higher, right? Uh,
Because of team size?
Primarily,
Okay.
and team size, and all the issues that were there earlier with the erstwhile product, where you didn't have line of sight on profitability. So combination of factors, and then we were hit by COVID, which kind of precipitated everything. So I think
So
the first
you bought the company once COVID hit. like after COVID?
No, no, 2023.
Okay, okay. Beyond COVID. Okay,
Yeah,
okay.
but I was already
Okay.
deeply involved.
Right,
And
right, right.
first
Okay.
thing was I was deeply involved, and for a very long period post COVID till 2023, I was not the legitimate owner, but I was running the company. COVID did one. The only good thing COVID did was it allowed us to completely close the erstwhile product. We said we're not going anywhere. The new product was already work in progress, and we just went ahead and launched it. Right, and we launched it in all the wrong hospitals in the beginning. But one hospital fired. There was a period where, in that period, we had to also reduce staffing, which I think many people did in COVID because there was no business essentially, and hospital businesses were fairly bad, especially for our side, because you could not even go to a hospital to make a BD pitch. You can't enter. There is, how do you do a BD with a guy when you are wearing a mask, you have gloves, he's sitting behind a screen? You may as well not go. In most cases, you can't even go because hospitals were either in a red zone and there were other issues, right? So first was to shut down the erstwhile product, trim the team wherever required, let go of cities, and then start a product which we felt had more power. And you don't need to see too many signs of victories. As long as a few signs are there, your gut will tell you if you listen to it. So gut instinct kicked in, and that's when we started building the product. Um, Post which I think we consciously made an effort to continue adding more edges, but we could not afford to be a single product company. That's a big risk. Something changes, your story gets really compromised. So you want to have multiple products. So it's not easy to do a turnaround, but I've been part of turnarounds in the past as an involved investor. So past background always helps because turnarounds are not easy. You can gloat about it once they are either work in progress or they have happened. But when you're at it, every night can be a nightmare when you're going back. Have you been part of any turnarounds?
No.
You can live through one. I've lived through two or three now.
Yeah.
And if I go in for a comprehensive healthcare package, there are 100 things that are not going to be right. It is thrilling. But to be able to manage a situation with your back to the wall, limited runway, it really keeps your adrenaline flowing. Sometimes it can actually make life very difficult because small triggers can result in very shaky decisions because you're on the edge all the time.
Okay, okay, understood. Okay, what is uh, what was your journey of becoming an investor? How did you become an investor?
Everything happened by accident. I was in Future Group reporting to Kishore Biani when one day he introduced me to someone who's still a part of my journey here, and uh, actually made me into what I am. That gentleman's name is Sanjeev Gupta. Sanjeev used to be the CEO of Coca Cola, and he- my boss KB introduced me to Sanjeev, and I was only supposed to help him make a PPT. And Sanjeev is someone who says, I will want an inch, and he will then take 100 acres, right? So he became so involved in my life in terms of work that he said, you might as well stop doing what you're doing and join me full time. So that's when I linked up with him. I entered through the operating route where he wanted to know how do you run retail businesses. He didn't have any background because he said I can sell tel, sabun, Coca Cola. He was in levers earlier. But yeah, what is this retail? So location businesses I understood, which is why hospitals I can understand. Right? It's a lot to do with your TG, the segmentation, the locality. So that's how I entered and spent a lot of time with him. Then
And
moved
this
on.
is Everstone that you're talking
I
about.
was on. It was earlier Indivision, then Future Capital. Yeah, but primarily that, and then Low Capital, where actually my journey as an investor started because they taught me how to invest Let me put it that
What is Everstone's history? Who started it? And
way. Everstone's history pretty much available on the net. So it was started by Sameer Sen. So I think that is available. I don't want to get into that. But from Everstone then to Lok, which is where my eyes opened about the reality of India. And I think the toughest business for me was to manage a milk business out of Jharkhand. That really took a lot of stuffing. It's a very, very difficult business, I realized, because when the whole world is sleeping, your guys have to be on the road because milk has to be available at 4 o'clock, 5 o'clock. And Jharkhand has its own challenges as a state because it is still coming up. So infrastructure, etc., etc., a lot of potential because great mining, but and that company continues to do well, very well. But ours figuring out who's our customer and why is the dahi melting, why is the product not coming through. So Lok forced me to travel outside large cities. A lot of work in smaller cities in South India on the lending space, on some of the other areas. Um, Also continue to do a lot of work in healthcare. So got involved with an eye company based out of Bangalore, Dr. Mohan Diabetes. He's a pioneer in the world of diabetes. Healthcare journey actually started with Everstone and investment in global hospitals, which is where I met Dr. Ravindranath, who is one of the pioneers of transplant in the country. He's now working very closely as not only an investor but as also as a mentor. So he's the guy who actually went against common thinking at that time, which was transplants will not work in India. Who will pay? And I have a personal story because my sister-in-law had to go through a lung transplant, right? And it is all because of him. So the journey as an investor is always interesting. You're working in multiple areas, and you are seeing different thoughts play out, different themes play out. You are also seeing a lot of burnouts. And if you spend some time, you will always understand, again in hindsight, there were fundamental issues in the promoter. Everything can be resolved: the product, the market, product market fit, the pricing. What cannot be sorted out is the thinking of the promoter. And that is where, obviously there are areas like valuation and all. That is where it can go wrong.
What's an
So
example of flaws in thinking of promoter? Like, what are the symptoms of it? Or
over aggression. See, promoters are naturally aggressive. You will not find a promoter who's meek, right? So you need to know when to accelerate and you need to know when to pull the brake. You reverse the activities, you are headed for a crash. Always, I feel emotional judgment or EQ, that has to be something that you need to take a quick punt on. Is this a guy who will react well to adversity and make the necessarily changes, make the right changes, or make the changes at the right time, or not? And it often boils down to that, because business cycles will never be smooth. They will always be rough weather. How do you react to a rough weather? If you're flying a plane in a storm and you decide, Ki, I'm going to increase the speed, well, there's a problem, right? uh, in fact, some of the companies which were managed by erstwhile professionals who became founders were actually massively successful because they were able to mitigate risk better.
hmm,
It
okay.
came naturally.
Hmm.
And I also realized why some of these companies were successful is because there was not one person, there were two, three co founders who were working. And that's a very tricky area. You can go completely wrong and it can ruin the business, or you can go really right. The onus is on the promoters to be able to find common ground and have the maturity to be able to fix problems. But it's a fascinating subject, leadership behavior, and you can spend years and decades and that will also not be good enough. as to why X leads to Y.
Hmm. Okay, fascinating. Um, you know, as an investor or from the lens of an investor, what are white spaces in the Indian market today? Like someone who's thinking of starting up, what do you think are interesting areas to build in?
So I'm a bit out of touch with it. I can only tell you in and around my areas what will work. So, for example, I feel that wellness is a huge space in India
And what do you
because
mean by wellness? Like,
wellness products, wellness services, working
like
on
say
overall
meditation.
all of them,
Okay.
and the beauty is that it doesn't wellness as a space is not being correctly addressed because it's not just a product or one service. It's actually can be or should be a, a bouquet of services
But Cultfit
because
is doing that, right? Like wellness. I would say Cultfit is a wellness company. Would you agree with
I
that?
would put it down as wellness, one of the elements of wellness. But
Hmm.
physical, mental, psychological, they are all food. They are all part of the wellness journey. So, uh, uh, I mean, there was a lot of involvement in the past. In the past, as far as I was concerned, on food. Earlier, if you put healthy packaging, and I'm going back to when I was in Future Group, it was very difficult to sell that product. वो आदमी नहीं लगेगा कोई
Okay.
because health and taste any which ways were two alien concepts. And there were some companies that actually did a good job, but they just got screwed because they went the health route. Now, if you put health, at least the first trial will be induced. Post that, that post purchase dissonance, that is something you will have to manage, right? If the packaging has a very high or very low, sorry, reason to believe, and they kind of dupe you into buying it, and then you have it and you say, damn, thing tastes like crap, you will not touch it with a barge
Hmm.
pole. But the acceptability is huge on the
I
wellness side.
think Maggie did a very good job of riding on the health with the Atta Maggie. I mean, they probably inspired other companies to think of health as a plank with the Atta Maggie.
Yeah,
I mean,
that,
it's
yeah.
probably it's not really healthy. It's just a positioning. I don't necessarily say it's healthy, but at least creating the impression that, oh, this is Atta Maggie, this is not maida, and thereby creating a good category there. I think they were a pioneer in that.
So that is, yes, you're right. So that is an attempt by them which kind of perhaps opened the market. Beverage space is very interesting. If you see the beverage space, I see one new product on the shelf every month, right? I make it a point to go to at least one or two of the supermarkets, or even if you're on LinkedIn, on Blinkit, sorry, you will see one new product in a month. And I remember some people had predicted that it is bound to happen. uh, and I'm just very happy to see that the quality of the products are also up there, because if you have studied or worked abroad or lived abroad, when you go to the markets over there, you will see that low sugar alternatives have been around for forever. That India is embracing this finally is, I feel that's a great space to be in. uh, so this whole health play can come through very well. There is a lot of activity which is happening in the and ML side. I'm not still very sure as to what are the models that are going to come through. That I think will impact almost every space, right?
How would
uh,
it impact the wellness and health space?
we're able to perhaps able to, so look, we get a lot of information about patient needs, patient requirements. uh, in maybe in some time you can use some of that to even predict trajectory as to where this is going to land up, and it can actually play a big role on the prevention side. That if you take the data of similar such people in similar pin codes, there is a lot of similarity in disease prevalence. It can be, it's not difficult to understand why. It can be because there are high income people who are living there who perhaps are eating food which may not be appropriate. You can also do a lot of work with discipline prevalence or disease prevalence. Where is this likely to go? And you can use a lot of that learning to say what perhaps is the right interventions. There's a huge play on that data. So business is changing, and parts of India always will require some of the traditional products. So, for example, protein, milk, all of these will continue to find their way in under-penetrated market. I'm a big fan of people who think it's not necessarily that every business has to be a national business. There is huge possibility for you to do things and have massive scale even while being a regional business, right? Because the complexity is so huge and the offtake is so high that for some products which can perhaps be claimed to be sold nationally, you might still never get there, right? Organic food, massive area of growth. Now people are willing to pay. 5 years back, perhaps it was too early. And there are a lot of people who've been trying things. Some have worked, some have not. But some of these areas are interesting areas.
All right. Okay. Awesome. Thank you so much for your time, Aditya. It was a real
Thank you.
pleasure chatting with you.
Same here. Thanks, Akshay.